Hello everyone, welcome to Talking with Dr. Laz, your favorite health program on television, reaching you from your channel of choice, AIT, in Nigeria's capital city, Abuja. My name is Dr. Laz Eze. October every year is commemorated worldwide as Breast Cancer Awareness Month, but advocates don't just talk about breast cancer, talk about all forms of cancer, creating awareness, because cancer remains a major public health problem of huge importance, causing a lot of pains in families, causing a lot of resources, both in families, the government, and the world all over. Cancer is a very serious disease, but it is preventable, it is curable if detected and treated early. So today we're not going to be focusing so much on the burden and the problem. We know it's a very big problem. It can be very depressing to talk about the pains and, just something very depressing to talk about. But there is good news. In the last 2 decades, Nigeria has made some progress in the effort to control cancer. Still very far from where we are supposed to be, but we must be able to talk about the gains so as to at least encourage ourselves that all is not too gloomy. So today on the program, I have many persons who have played critical roles at different levels in the progress we've made. So as part of our solutions series, where we talk about progress made, solutions to problems, what we have to learn, the impacts that have been made, and what we can do better. We are presenting this today. And I have with me 2 guests in the studio and 2 joining me virtually from Lagos and Enugu. So I have the president of Nigerian Cancer Society, Dr. Adamu Hassan Umar. He's a public health physician at the Federal Medical Center, Ngulu, Yobe State. And he's there with us in the studio. You're welcome, Dr. Umar.
Thank you very much, Dr. Laz, for having me.
All right, thank you, sir. Also in the studio is the Publicity Secretary of the Healthcare Federation of Nigeria. He's a pharmacist as well, Kolakpo Fakponda. You're welcome, sir.
Thank you very much for having me.
All right, and joining me via Zoom is a professor of radiology, a radio-oncologist, a founder of Breast Without Spots, and a strong health advocate, board member of a lot of cancer organizations, Professor Ifeoma Okoye. You're welcome to the program.
Thank you very much.
I can see you, Pinky Prof. Welcome. Then Mrs. Mojisola Animashaun is the founder of St. Cyril Cancer Treatment Foundation, joins us via Zoom in Lagos. You're welcome to the program.
Thank you. Hello, everyone.
Okay, so it's a packed program. And we'll be talking for less than 30 minutes. So we'll go straight to the point, but we'll get into the conversation proper right after this short break. Do stay with us. We'll be right back. Welcome back to Talking with Dr. Laz, your favorite health program on television. Yes, we are talking about solutions to cancer in Nigeria, the progress and the prospects. And I'll go directly to the president of Nigeria Cancer Society. He's our president, so that's why I'll get to him first. Dr. Hassan Umar. Yes, significantly in the past 2 decades, can you quickly summarize the progress you think we've made as a country in the area of cancer control?
Thank you very much once again, Dr. Laz, for having me on this program. When we talk about the last 2 decades, to the pessimist, one can say nothing has been achieved. But to those of us in the Nigerian cancer space that are optimistic and will remain optimistic, we cannot say we are where we were yesterday. So some significant progress has been made, and by the grace of God, the momentum is changing, and by the grace of God, we will continue to push for more gains to be recorded.
So what was your NCS response? Or what has NCS done during this period?
Well, yes. You see, the Nigerian Cancer Society, in collaboration with all the partner organizations and individuals who are advocates, advocating for, adequate provision for cancer in the health budget, adequate coverage. We have been sustaining the effort of calling for universal health coverage. And of course, we keep on engaging policymakers on the best strategies to improve on policies, the best strategies to improve on budgetary provision for health generally, and of course with particular interest to cancer.
So do you think those efforts has led to improvement or additional policies or increase in budget for cancer?
Well, definitely, because like I said earlier, to us that are very optimistic, we see the light at the end of the tunnel. And by the grace of God, we are going to have some significant inroads in creating, some changes, in bringing about positive changes to the cancer care paradigm in Nigeria.
So let me get to Pinky Prof. Prof. Sokoye. Prof. Sokoye, in the last 2 decades, what are the basic significant efforts that your organization have made towards promoting cancer control?
We still trying to dent the late detection issue, is the vein why Nigeria needs to have the highest cancer death rate in Africa. So our major effort is to debulk the tumors that get to us in the hospitals in order to improve survivors statistics and be able to create enough survivors to be able to share their stories. So the action of my NGO has always been focused on debulking the tumor and getting these patients earlier to the hospitals in order to improve survival statistics. And how have we been doing that? We've been doing that through mass action. We've worked with the NYSC from 2009 to date, and we've been able to reach 27 states through their CDS program. The target was to hit the 36 states of the country and reach the 774 local governments. But due to funding constraints, we were unable to do that. Now in Enugu this year, we've instituted an action and mobilized 500 women, training them to become women cancer advocates, to move with us, and also school clubs, cancer control school clubs in secondary schools, and working with 34 different gender-based, non-gender-based organizations and professional groups together, all hands on deck, create a mass action that should be able to reach the 17 local governments of Enugu State in the next 1 year. So, riding up on what we have been doing nationwide, but focusing on the state to use it as a template to rid Nigeria of late detection of cancer, one state at a time.
Okay, that sounds really great. Thank you very much for that, Prof. I'll come back to you. But let me go to Mrs. Mojisola Animashaun from St. Cyril Cancer Treatment Center. Yes, you've heard the president of Nigeria Cancer Society and a fellow civil society organization. So from your end, what is impact that you've made or you've contributed to making in the cancer space in the last couple of decades?
Thank you very much. For our organization, we've been around for less than 2 decades. So, but during that period of time, we've been creating awareness since 2015 through seminars and information dissemination online, as well as talking to women in the marketplace to create awareness within our locality. When we were in our clinic in Isolo, and now our clinic in Surulere, we go to Surulere and Mushin local governments and environs to create awareness. And we've also been screening. We screened 1,000 women last year for breast and
were those screenings for free?
Screenings, and through that screening, we were able to get cases earlier than they would have done if they hadn't come for the screening. And also the other thing, which is our NGO is focused on treatment, giving holistic treatment to patients. And we've moved forward in that our patients, when they come to us, we ensure that not only are we looking after their body, we're looking after their minds financially, so that to make the burden that is that they come with a lot lighter. So over the past 5 years, we've worked on treating patients. We have a program for financing patients And then we have a counseling
But
group.
by that,
and
do you support
we
patients
look at
on
the mental
funding, or do
well-being
you
as
treat
well
them
as the
free?
physical well-being. So that's what we have done in terms of pushing the needle, and we've seen the results in people actually having being caught early, and people being treated for precancerous cervical lesions.
Okay, thank you very much. Let me come back to the studio. Kolakpo Fakponda, Publicity Secretary, Health Federation of Nigeria. So what's the most significant impact that has been made, that your organization contributed to making in the cancer space in the recent past?
Thank you very much, Dr. Lars. I think for the Healthcare Federation of Nigeria, we are a coalition of private sector healthcare stakeholders in the country, speaking with one voice on behalf of the health sector, advocating, primarily that's a major role, advocacy, advocating for improvements in healthcare, advocating for policy implementation, advocating for policy changes, And one of the major things we've achieved recently is the implementation, or let me say the provision of the Cancer Health Fund, right? Which is now appropriated in the 2020 and also the 2021 budget. We have roughly a total of about ₦1 billion that has already been kept aside for indigent patients. And this will be used to support patients with prostate, breast, and cervical cancer, at least in this first instance. The implementation is about to start, but I don't think anyone can take it away from the private sector that was driven by Healthcare Federation of Nigeria's advocacy efforts to the National Assembly, to the Federal Ministry of Health, advocating for patients who are indigent, who are unable to cater for their own care, for the government to support them in having access to standard of care treatment, regardless of where they are in the country.
Okay, is it the same fund that the Federal Ministry of Health says citizens can access up to ₦2 million to treat some of these health conditions, indigent people in 6 healthcare facilities in the country?
Yes, I believe you're speaking to the same fund. So presently, it's going to be piloted at 6 federal institutions, which are cancer centers in the country. These institutions are spread across the 6 geopolitical zones of the country, and this is how the implementation will happen.
Okay, thank you very much. We might take a break in no distant time, but before we do that, how would you want to summarize? Could we say that from what I heard from 4 of you, that in the last 2 decades we've made progress in terms of awareness creation, since every one of you talked a bit about that, advocacy for policy, and one of the results is this Cancer Health Fund that will be used to support indigent Nigerians to access cancer care in 6 pilot federal health institutions in the country. I think we'll put that on the screen for you to know those teaching hospitals and federal medical centers across the country. So what about cancer treatment? Coming to you, the NCS president, Dr. Umar, what progress have we made in this regard? I recall when I was in medical school, my first surgery posting was in oncology. And I suffered a lot mentally because almost every patient we were having with breast cancer and other forms of cancer, we get to lose them within a short while. We had no radiotherapy machine at UCH Ibadan at that time. So could you speak to, has there been any progress in terms of treatment of cancer in Nigeria in the last 20 years?
Well, thank you very much. You see, listening to, the Prof from Enugu, Professor Ifeoma Okoye, and Mrs. Anima Shaun from Lagos, you will reason with me that when our individual and collective efforts are collected together, the total sum will definitely go a long way in translating to better health outcomes. As rightly stated by Professor Ifeoma Okoye, the major problem we have in Nigeria is the lack of awareness. That's number 1. Then lack of awareness translates to late presentation. And they said early detection is key.
But one may argue that some persons who detect early and go for treatment, do we even have sufficient equipment, the capacity to manage them? Because go to National Hospital and Luth, you have queues of patients, those who even have money to pay. Are they having access to the care?
That is the problem. That is where we talk about the 3 A's of availability, accessibility, and affordability. And that is the main reason why we will continue to press on the universal health coverage for all Nigerians. That is the reason why the Cancer Health Fund that was just talked about by my colleague from the Healthcare Federation of Nigeria, that is why we continue to hammer, to call on government to increase the fund, to call on government to increase the number of hospitals, and to call on government to also increase the form of cancers that can be covered under that fund. Because, you know, like we rightly say, prompt diagnosis and treatment is equally key. And of course, we know the state of the health sector in Nigeria. You know, lack of basic equipment for screening and treatment is a major concern.
Okay. All right, thank you very much. I think we have to take a break, but it's good to know that perhaps now we have one of the best cancer treatment facilities in West Africa. I think that's the NSIA Lute Cancer Center in Lagos, with state-of-the-art equipment. Is a public-private partnership. I think it's good to make that known. We are going to take a break, and when we return, we're going to continue this conversation. So much to talk about, but constrained by time. But as much as possible, we get to hear more progress. Do stay with us. We'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, I'm with 4 eminent persons, cancer advocates, 4 out of so many, and many organizations working very hard in Nigeria to push for awareness, good policies, and also good trainings for oncologists to make sure that we defeat cancer in the country. And they've been sharing experience on the efforts, their contribution, and some areas we've made progress. So I'll go back to our virtual guests. Back to you, Professor Okoye. As a radio-oncologist at UNTH, UNTH is one of the hospitals that got a brachytherapy machine supplied by the Federal Ministry of Health, I think, around 2019. What is the situation there at the moment? And do you see hope? You know, having supplied that is a progress that has been made from many years of advocacy. So what's the situation, and what are the bottlenecks you've observed in that regard?
Well, we were really battling with our radiotherapy machine for quite a long time till we had a PPP arrangement where the partner business person that manages it is quite dedicated to ensure that the machine is always up and working. And since then, we've been, having a good course, and patients are getting services, and we've not needed that much to push patients to other centers. There are some other progresses that we have made. Oncology center boasts of a very operative multidisciplinary team, and we hold meetings every week, once a week. Recently, we introduced a breast MDT as well, and we hold that every week, and that has helped that multidisciplinary approach. We've also participated, collaborated with the CAPTC, which is a global platform for managing prostate cancer, to create a virtual oncology platform. This virtual oncology platform is available to all Africa, to be able to house their clinical trials that are ongoing and enable patients to be able to have an idea of clinical trials that are available within the African region. I think this is really a very, very good progress that has been made.
Yes, we've got a lot of progress report there from Professor Okoye. Coming back to the studio, Mr. Fakponda, it's great to know the efforts of organized private sector. And I heard Professor Okoye talking about public-private partnership, having helped radiotherapy services. But from the aspect of the private sector, what are some specific challenges you've observed that is limiting growth and progress towards cancer control in the country?
I mean, thank you very much. I think when the president of the Nigerian Cancer Society spoke earlier, he mentioned about some challenges around infrastructure, right? So one of the challenges that the private sector today, as some of our members are facing, is the fact that we need to build more hospitals, more cancer centers. Nigeria does not have enough. We're not even near close 1% of the cancer centers we should have. And in doing that, it's a lot of challenge in terms of the policy regulations and in terms of customs duties. I'll give you an example. Today, when you look at the HS codes for importation, when somebody wants to bring in a theater light, it is under the same classification as a chandelier. Chandelier is an expensive light, you know, it's luxury. But this is a theater light that is to save lives. And when you put the same customs rating on both of them, you're making it almost impossible for the person to be able to import that light. So the tariffs on medical equipment is significantly high. And so we're asking government to review these codes so that we have dedicated codes, you know, and import duty for medical devices. I mean, we saw during COVID that a lot of waivers was given to healthcare, and I think that should remain the same so that we are able to build the healthcare space.
Okay, thank you very much for that. A lot of recommendations going forward. So I think we are really constrained by time. Perhaps we'll find other opportunities to continue this conversation, but I really like to get last words from the NCS president. What insights can you provide and perhaps additional recommendation, just in 30 seconds?
Well, thank you very much. You see, the bone of contention here is the fact that Nigeria, being a signatory, you know, with other African nations, of the 15% benchmark of the consolidated budget for health, unfortunately, we are still not far from where we were last year.
Okay.
There is a little increment in the budget presented by the President to the National Assembly last week, but just a very, to us, insignificant improvement, because the budget is still about 4.18% as opposed to the 15% benchmark.
Okay.
So we are still very far behind.
So we want more funding for health.
We need more funding for health, more funding for cancer in particular, and of course more health infrastructure, our hospitals, equipments, our radiotherapy centers, our machines.
And
so
also better use of the available funds.
Exactly.
Okay, thank you very much. So 10 seconds from Prof. Okoye on the way forward and how we can get better results. Okay, I can see Mrs. Anima Sharon is back. Okay, let me get that from her. Sorry about the technical hitches. So can we get your last words, ma, on this? We've made some progress, so much more to do. So for those who are still interested in being part of this cancer control effort, what insights, what message do you have for them?
Well, we still need many more NGOs because, like Professor Okoye said, the policies are being made, but they cannot be run by government agencies alone. St. Cyril, our foundation, is focusing on cancer treatment. So, but there aren't many whose area of focus is that. We need to be able to get inclusion of the NGOs into the government policies. When they are being driven, the NGOs should be an integral part of driving the results, pushing the research, helping with getting the patients. So any NGO that wants to come into the advocacy has to be able to be there for the long haul, has to be ready to ensure that when the chips are down and when you don't have any funds, you are creative in how you get funding, you're creative in how you give your patients succor, and also, most importantly, anything that you do must be patient-centric. We need to move away from working on policies so much as NGOs, but be able to help the patients in their journey, and let the those who advocate for policies be able to face that work. But I think that's really important. So when any NGO that's being coming on board, you have to be ready, you have to be patient, you have to want to spend your own funds, you have to be be passionate about what you do,
Right.
and this has to be reflected in what in the results that you get, because
Okay.
that is how we are progressing in Sensirial, because we know we're not here for today, we're here for tomorrow. I'm here, Sensirial will be here after I'm gone. That's the kind of mindset that we need to get into the cancer advocacy, because it's not a short-term program.
All right, it's not a short-term program. I think this is where we bring this to the close. Very exciting conversation within a very short time. I want to really thank all my guests. Kolakpo Fakwonda, Pharmacist and Publicity Secretary, Healthcare Federation of Nigeria. Thanks for being on the program.
Thank you for having me.
Mrs. Anima Shaun, who just made the last few statements. Thank you for being on the program. Thanks for the great work you're doing through Sensirial Cancer Treatment Foundation. Thank you, Professor Ifeoma Okoye, who is also the Director, University of Nigeria Center for Clinical Trials. Thanks for all you do. And back to the studio again, thanks to our president. I'm also a member of the Nigeria Cancer Society. So thanks to Dr. Hassan Omar, President of Nigeria Cancer Society. And thanks to everybody, all the organizations, all the NGOs, all the individuals, all the patient survivors. I had them on this program many months ago to tell their story. Everybody, government, private sector that is playing one role or the other to make sure that we control cancer in Nigeria. We've made some good progress, but there is still so much more to do, so much more to do. And we can't wait to do more. All hands on deck. Cancer is treatable, is curable when it's detected early and treated promptly. So that's much we can take today. I really thank my production crew for delivering this despite some issues we had at some points on the program. And I thank you for watching. Same station, same time next week. My name is Dr. Laz Eze. Bye for now.